We're here at Cardiovascular Experts in Camp Hill. Joining me right now is Dr. Raj Dave, President and CEO of Cardiovascular Experts. Thanks for being with us.
Welcome.
Tell me, are heart attacks more frequent during the holiday season?
So first of all, I want to tell all your viewers happy holidays. And yes, the research have shown that during the holiday season, there are 3 days where we see the highest number of heart attacks in the United States. It's December 25th, which is the Christmas day, the day after Christmas, 26th, and January 1st. So there are many reasons for this to happen. As we know, there are lots of risk factors for having heart disease, smoking, diabetes, high blood pressure, hypertension. However, also the time of the year and stress is also known to be a risk factor for having heart condition. And that's very important at the holiday time because everyone gets really stressed out. There is lots of things going on in their life. They sometimes miss their medications. So they overindulge themselves in rich, saltier foods, alcohol. So yes, it's absolutely true that there is more heart attacks during the holiday time. And we should be aware of it.
And that's really why it's during the holiday season that's why it happens.
Absolutely, yeah.
Now, you have a few points that you can give us to sort of keep in mind during the holidays so that we can avoid something like a heart attack.
Yeah. So I tell my patients all the time that don't get caught up in too much during the holiday time because everyone has a long list of things that they want to do. They have lots of friends to get together, lots of parties, lots of gifts buying, and they're frantically trying to check off a long list of things that they want to do. And I think that they really need to step back and say, okay, let's, try not to do too much. Not every holiday tradition needs to be honored every year, in my opinion. They can honor some traditions, not all of them. They can pardon themselves from some of the holiday parties which are stressful. I've seen in my 20 years of practice many heart attack patients that showed up straight from a holiday party where they met some people that caused an immense amount of stress and gave them a heart attack. So, feel free to excuse yourself from one of those parties to make time for some rest in between. A lot of people gets caught up into this idea of that, this Christmas I'm going to change the world, and they start doing a lot and they want to become very physically active. So I think I always warn them that, yes, you be physically active and that's a great thing, but don't overdo it. Most important thing that is always listen to your body because a lot of people don't want to seek medical help during holiday time. So if they're having chest pain and say, oh, well, it's just a shoulder or whatever, and I'll see a doctor next year. And I think that's a problem. And that's part of the reason why we see sometimes people get very sick during holiday time because they're not listening to their symptoms. So these are some of the important things. Don't overindulge yourself. I mentioned that earlier. I think a lot of saltier foods leads to a lot of admissions during holiday time for heart failure. That can lead to heart attack. It can lead to heart arrhythmias. And you can see that the hospitals get really full during that time.
Okay, lots of really good advice. We're going to talk about heart attack symptoms coming up right after the segment, but we need to take a commercial break. Stay with us. We will be right back.